Good afternoon, my lovely people. Welcome back to our YouTube channel. And it's my hope you are fine. Personally, I'm fine, as you can see. And I always thank God for the gift of life. And as I always say, if you are there and you are watching this channel for the first time, don't be left behind. Take a second or two, click the subscribe button, and after subscribing, don't forget to put the notification bell on so that whenever I produce a video like this, YouTube will automatically notify you. And for the returning subscribers, I always appreciate you because this channel has gone this far because of you. And without you, you can't go, we can't forge forward. For the better part of this month, we have been discussing about kidney failure, a very important topic in our lives. And I do appreciate those who are commenting on my job, those who are learning something from this channel, because the purpose of the channel was to educate you people. For those who have given their topics and have not yet discussed them, I always say that we should learn to exercise a bit of patience, and in due time, your topic will be discussed. We are still looking at the long term outlook for chronic kidney failure. And we had started talking about prevention of chronic kidney failure. How will you prevent chronic kidney failure? We started by saying that we have two major causes of kidney failure, which is high blood pressure and diabetes. So we can be assured that if you prevent these two diseases, which are the major causes, you'll be able to prevent chronic kidney failure. So we started looking at the guidelines in prevention of chronic kidney failure. We discussed the first three, and the fourth one is, if needed, try to maintain a moderate weight, and this can mean consuming fewer calories and increasing your activity. If needed, try to maintain a moderate weight, no weight gain. Try to maintain a moderate weight, and this can mean consuming fewer calories and increasing your activity. Activity simply means exercises. And doctor can make or provide healthy weight loss guidelines. A doctor can provide or make health weight loss guidelines. Number 5, Over-the-counter pain relievers can cause kidney damage. Those who love taking Panados, diclofenac, when you feel some pain, you just run to the chemist or to the shop, you get those over-the-counter pain relievers. They will end up damaging your kidneys because the kidneys are responsible for removing all those toxins, detoxification, and all that. So you'll be overworking them. So always, when you feel something or some pain, make sure that you go to the doctor, samples are taken, so that you may know what might be disturbing you instead of taking painkillers each and every day. Over the counter pain relievers can cause kidney damage. A point to note, follow directions on the package. Follow directions on the package. Only take them as needed and discuss the use of pain relievers with your doctor if you have any kidney concerns. Follow directions on the package and only take them as needed and discuss the use of pain relievers with a doctor if you have kidney concerns. Number 6, consider quitting cigarette smoking. Consider quitting cigarette smoking. Another point to note, chronic kidney failure develops over time at first. Chronic kidney failure develops over time. At first, you may not notice symptoms, but symptoms may appear as the disease progresses. We have repeated this time and again that chronic kidney failure develops over time. And at first, you may not notice symptoms, but symptoms may appear as the disease progresses. During the early stages, we said that kidney failure might be asymptomatic or might not show any signs. But as the disease progresses, it will start showing signs. The patient will start feeling uneasy. The patient will start feeling sick. And all those signs we have discussed them in this topic on this channel. So those who have been following me, you know all the signs. So chronic kidney failure develops over time. At first, you may not notice symptoms, but symptoms may appear as the disease progresses. You may be more likely to develop chronic kidney failure if you have certain health conditions, including diabetes and high blood pressure. And we have been repeating this time and again that if you may be having high blood pressure, if may be having diabetes, this predisposes you into getting chronic kidney failure, especially if they are not controlled. You may be more likely to develop chronic kidney failure if you have certain health conditions, including diabetes and high blood pressure. Preventive measures and treatment may slow the progression of kidney failure. Here we are not talking about healing completely. We are talking about slowing down the progression, slowing down the rate at which your kidneys are getting damaged. Preventive measures and treatment may help slow the progression of kidney failure. Let's look at acute kidney failure. We have finished about chronic kidney failure, which comes over time, slowly by slowly. And now we are looking at acute kidney failure. This may happen suddenly. It doesn't occur in the long term. Acute kidney failure. It happens when your kidneys suddenly lose the ability to eliminate excess salts, fluids, and waste materials from the blood. The key word here is suddenly. In chronic kidney failure, it occurs slowly by slowly, but acute is sudden. It happens when your kidneys suddenly lose the ability to eliminate excess salts, fluids, and waste materials from the blood. This elimination is the core of your kidneys. This elimination is the core of your kidney maintain function. This elimination is the core of your kidney main function, sorry. So here we mean that the main function of the kidney is removing or eliminating excess salts, fluids, and waste materials from the blood. Kidneys are the filtering system of your bloodstream. So this elimination is the core of your kidney's main function. Body fluids can rise to dangerous levels when the kidneys lose their filtering ability. Remember, we said that kidneys also assist in maintaining fluids in your systems. So when the function of the kidney to filter the fluids disappears or is compromised, body fluids can rise to dangerous levels. The condition will also cause electrolyte and waste material to accumulate in your body, which can be life threatening. If those wastes, which are always eliminated by the kidneys, are not eliminated, what do you expect? They will accumulate in your body, and this can be fatal. This can be life threatening. The far we have gone, if you have been following this channel closely, you can tell that kidneys, I'm not saying they are the only organs which are very important, but it's one of the most important organs of your body systems. When they lose function, they lead to so many complications. And this marks the end of our video today. Let's continue subscribing, liking, and sharing our videos so that they can reach as many people as possible and help the community at large. Goodbye.